The topic was on progressive MS and the therapeutic challenge that it presents. So I think in the presentation I made the point that there are a number of areas being actively pursued, so that which is very encouraging. But now there is one treatment based on B lymphocytes, which we understand has positive results and which will be presented tomorrow. So of course that's a huge benefit, because that means we no longer say this is untreated. We have a potential treatment, but it's really only the first step. One can't prejudge the results, but I suspect we'll see some benefit, but we'll want much more benefit over time. So this may be akin to the beta interferons of the early 90s, and now we want the next 12 drugs to come along as well. I think greater focus on identifying new targets. So at the moment we're focusing on rather similar targets around immunology. I think now we need to think about new targets that are really relevant to neurodegeneration and to neuroprotection. And that's where a lot of the current early trials are looking at, and it's also where the Progressive Alliance is really pushing for new developments. I think what it does is it raises the whole profile. This is now an active, dynamic area. There are things happening in this space, and we want more and more to happen in this space. And through the Progressive Alliance Awards and the RF82, we're going to have some big networks focusing on progressive MS, and through that we want to see new targets. So it's just raising profile, raising awareness, and getting real activity, concerted global activity in this area. The Alliance is hurtling forward at breakneck speed. Since I spoke to you last, we had our RF82, that big network call. We had 54 applications, about 500 investigators around the world. We've shortlisted with great difficulty down to 11 applicants, and they are now in a planning round for the next 9 months. Then they will submit to the major award, 4 million over 5 years, which will probably make 3 to 4 awards. So it is moving very fast. But we now have to regroup and see, okay, what's the next step from this? We need to sustain, we need to bring in more funds, so there's a major international appeal, and we need to move to the next level. The focus is effective treatments in progressive MS, and the absolute focus, of course, would be the prevention of progressive MS. So in other words, the early treatments that will actually stop people moving into the progressive phase. Time is always a really difficult question. I'm amazed at how much progress we've made over the last 3 years. I would be very surprised if in a further 5 years we don't have some other treatments alongside tomorrow's announcements. It will mean identifying new targets, perhaps identifying agents that can be repurposed to focus on progression, and it'll mean some pretty nifty trial designs so they're evaluated quickly so that we can get more drugs to our patients sooner. It's the first step in treatment, taking a particular approach, and there are many other approaches that must be considered that may have as good, if not better, effects over time.